Welcome to the Deep Dive. Today, we're going to be diving deep into healthcare in Jharkhand.
Jharkhand.
Yeah, it's a state in eastern India.
Right.
And, it's got a really unique set of challenges when it comes to healthcare, but also some really cool solutions that they're trying to implement based on all this stuff that you sent me.
Yeah.
It seems like, they're really trying hard to reach everyone with healthcare.
Mm-hmm.
And there's programs like MSBY and Ayushman Bharat.
Yeah, those are two of the big ones.
Okay.
They're government health insurance schemes, and they're really trying to help people, afford treatment.
Yeah, especially those who are struggling financially.
Exactly. And what's interesting is they cover both public and private hospitals.
Oh, so it's not just limiting you to one or the other.
Nope. You got options.
Having options is always good.
Absolutely.
So that's a great start. But how does the healthcare system actually work in Jharkhand? Like if I were to try to picture it, what would I see?
Okay, so picture a pyramid. At the top, you've got your tertiary care hospitals like RIMS in Ranchi,
Right.
and the brand new AIIMS in Diogar.
Oh, wow.
These are the big guys. They handle the most complex cases.
The top tier stuff.
Exactly.
Gotcha. So what's below them?
So then you've got district hospitals.
Okay.
These are in major cities. And then as you start going out into those more rural areas, you've got the CHCs, community health centers, and the PHCs, the primary health centers.
Okay, so those are reaching out further.
Right.
And what about like the really remote areas, those tribal communities?
Yeah.
How do they get care?
That's where the subcenters and the HWCs come in. They're the health and wellness centers.
Okay.
They're kind of like the healthcare outposts, bringing those basic services to people who might not have access otherwise.
Wow. So it seems like they're really making an effort to reach everyone no matter where they live.
Yeah, that's the goal.
That's pretty impressive.
It is. But even with this, multi-tiered system, there are definitely some hurdles, some big ones.
What kind of hurdles?
Well, one of the biggest is the shortage of doctors and medical staff, especially in those rural areas.
Yeah, I can imagine it's hard to convince people to go work out there, especially if they have better opportunities in the city.
Exactly. And to make things worse, Jharkhand doesn't have a lot of medical colleges.
Oh, so they're not training enough doctors within the state to begin with.
Right. So it's a domino effect.
Yeah.
Fewer doctors trained, fewer doctors available.
Especially in those areas that need them the most.
Exactly.
And so what does that mean for people in those rural areas? What's the impact of that shortage?
Well, some villages, they don't even have basic healthcare facilities.
Wow.
And the ones that do exist, they often have problems,
Problems like what?
Like equipment's not great, or there's not always electricity, or they run out of essential medicines.
So even though the system is designed to reach everyone, the resources just aren't always there to make it work.
Yeah, you hit the nail on the head.
So infrastructure and personnel, those are the big things.
Yeah,
Well, it sounds like a tough challenge, but at least it seems like the government is trying to do something about it.
Oh, yeah. They've got a few things going on.
Like what?
Well, aside from those health insurance schemes we talked about,
Right.
there's Mission Indradhanu.
Mission Indradhanu.
Yeah, and it's all about getting kids vaccinated, especially in tribal areas.
Vaccinated against?
All those diseases that we can prevent, like measles and polio.
Right.
It's huge for improving overall health, especially for the little ones.
Yeah, definitely. And what about moms and babies? Are there any programs focusing on them?
For sure, there's Janani Suraksha Yojana, JSY,
JSY?
and Mukhyamantri Swasthya Bima Yojana, or PMMVY.
PMMV,
Catchy names, right?
a little bit.
But basically, they provide financial assistance for giving birth in a hospital.
So it encourages safer childbirth practices.
Exactly, because, Jharkhand still struggles with high maternal and infant mortality rates.
Right? I read about that.
It's a big problem, and even with these programs, it needs a lot more attention and investment.
Definitely. But it's not all doom and gloom, right? What about those innovative approaches I read about? How are they reaching those remote areas?
Oh, yeah, that's the exciting part.
Tell me more.
Okay, so they've got these mobile medical units.
Like a doctor's office on wheels.
Basically, yeah, they bring healthcare to the people instead of making them travel for miles.
That's amazing.
And then there are the ASHA workers.
Oh, yeah, I read about them.
They're like healthcare superheroes.
Really?
Yeah, they go door to door in these villages, spreading awareness, connecting people to services.
Wow, so they're like the front line of healthcare.
Exactly.
It's incredible.
And we can't forget about telemedicine that's becoming huge, especially in villages.
Oh, yeah, I can see how that would be really helpful.
You can consult with a doctor remotely, get a diagnosis, even treatment advice without having to travel.
That could be a real game changer for those who have trouble accessing specialized care.
Definitely. Although, of course, there are challenges with internet access and all that.
Right. Not everyone has a smartphone or reliable internet.
Exactly. So even with these amazing solutions, ensuring equal access for everyone remains a challenge. For sure. But it's inspiring to see Jharkhand tackling these issues head on.
It is.
Using, a mix of old school methods and new tech.
It sounds like a really dynamic healthcare landscape.
It is.
With a lot of potential for positive change.
Yeah.
But we can't forget about those hurdles, right? Like the high disease burden and malnutrition.
Right. Those are the big ones.
One report said that Jharkhand has one of the highest malnutrition rates for children in all of India.
Yeah, it's a serious problem.
That's really alarming.
It is, and it shows just how urgent this issue is.
So what are they doing about it?
Well, the government launched Poshan.
Avian.
Yeah, it's a national program aimed at tackling malnutrition.
Okay.
It includes things like supplementary nutrition programs.
Okay, so actually giving people food.
Right, but it's more than that.
Oh, so it's about getting to the root causes of malnutrition, not just treating the symptoms.
Exactly. It's about education.
Yeah.
Behavior change and getting the community involved.
So it's about empowering people to make healthy choices.
Right, and making sure they have access to clean water and sanitation and encouraging breastfeeding.
That's great. It sounds like a really comprehensive approach.
It has to be. Malnutrition is a complex issue. There's no easy fix.
And it sounds like it takes a village.
Literally, the government, healthcare providers, and the communities themselves all need to work together.
And those HSA workers, they must play a huge role in all of this.
Absolutely. They're often the ones working directly with families, providing that education and support.
So even with all the challenges, it's encouraging to see these proactive efforts to improve health in Jharkhand.
Definitely. But we also have to acknowledge the private sector.
Oh, yeah. They're playing a bigger role now, too, right?
Exactly. We're seeing a lot of growth in private hospitals.
Especially in the cities.
Right. In places like Lanchi, Jamshedpur, Bokaro.
They often offer really good care.
But it's expensive.
Yeah. A lot of people can't afford it.
Exactly. And so you have this, quality care, but at a price.
So it's kind of a double-edged sword.
Yeah. How do you balance quality with affordability and accessibility?
That's the big question.
Especially for the most vulnerable.
Right.
And it's not just about the cost attracting skilled healthcare workers to those private facilities. That's a problem, too.
Just like in the public sector.
Exactly. Everyone's competing for the same talent pool.
And then there's the cost of setting up a hospital in the first place.
Oh, yeah. Especially in urban areas, land and operating costs are high.
That makes sense. So how do we overcome all these challenges?
Well, that's where the sources point to public-private partnerships, those PPPs, as a potential solution.
PPPs?
Yeah, remember we talked about those?
Right. Partnerships between the government and private companies.
Exactly. They can bring together the resources and expertise of both sectors to try to solve some of these problems.
So it's about collaboration, finding creative solutions.
Exactly. One suggestion is to include more private hospitals under the Ayushman Bharat scheme.
Oh, that would be great for those who need government assistance.
Yeah, it would give them more options for quality care.
And what about those telemedicine startups we talked about?
Partnering with them could be a game changer, especially for those in rural areas.
It's about bringing specialized care to those who need it most.
Exactly.
And there's potential for PPPs in other areas too, right?
Absolutely. Think about diagnostic labs, medical colleges, even tertiary hospitals.
By working together, Jharkhand could really improve its healthcare system.
It's all about leveraging the strengths of both sectors.
It sounds like a real opportunity for creative problem solving.
It is.
But we still need to address those underlying challenges like the workforce shortage and the high disease burden.
Right, we can't forget about those.
It's about taking a holistic approach, looking at the big picture.
Exactly.
And it requires commitment from everyone involved.
The government, private sector healthcare providers, and the communities themselves all need to work together.
Towards a common goal.
Right. To create a healthcare system that's accessible, affordable, and equitable one that truly serves the people of Jharkhand.
It's a great goal.
It is.
So where do we go from here? What are some concrete steps that could make a real difference?
Well, expanding medical education and training centers within Jharkhand is a big one.
Yeah, we need more qualified healthcare professionals.
Exactly. And not just training them, but making it attractive for them to stay and work in Jharkhand.
Especially in those rural areas.
Right. Incentives are key, better salaries, housing allowances, professional development opportunities, things like that.
That makes sense. What about the actual buildings and equipment, the infrastructure?
That needs work too, especially emergency response and ambulance services.
So people can get to a hospital quickly when they need to.
Exactly, especially in those remote areas.
That's crucial.
And we need to improve healthcare infrastructure in those tribal villages too, bring those basic services closer to home.
It all comes back to accessibility, doesn't it?
It really does, and that includes access to preventive measures like those maternal and child nutrition programs and disease control programs.
It's a lot to tackle, but it seems like the pieces are there to create real change.
Definitely, but what's crucial is making sure those policies actually get implemented and that they reach the people they're meant to help.
Right. It's not enough to just have good ideas. They need to be put into action.
Exactly, and there needs to be accountability, transparency, and a commitment to ongoing evaluation and improvement.
So it's a continuous process.
It is.
Wow, we've covered a lot of ground already.
We have.
Jharkhand's healthcare system is facing some serious challenges, but there are also signs of hope and progress.
Definitely.
It's a really dynamic landscape with a lot of moving parts.
It is. And as we move on to part 2 of our deep dive, we'll explore some specific case studies.
Oh, that's great.
We'll hear about the challenges and successes on the ground to get a more nuanced perspective on healthcare in Jharkhand.
This is getting really interesting.
It is.
I can't wait to hear those case studies.
Me too.
Stay tuned, everyone.
We'll be right back.
So we talked about the structure,
Yeah.
The big hospitals and the little clinics and everything in between. But what happens if you need something more than just the basics? What if you need specialized care?
That's a really good question, and that's where things can get really tricky.
How so?
Well, imagine needing treatment for something serious like cancer,
Okay.
but the closest specialist is hundreds of miles away in a big city.
That's a long way to go.
It is, and that's the reality for a lot of people in Jharkhand.
Wow. So not only is there the distance, but then there's the cost of travel and treatment.
Exactly, and those big city hospitals can be really expensive.
Even with those government health insurance schemes.
Sometimes, yeah, the coverage might not be enough.
So it's a double whammy. You might not be able to get there. And even if you can, you might not be able to afford it.
Right.
So is there any way to bring that specialized care closer to the people who need it?
Well, that's where those public-private partnerships come in.
The PPPs?
Yeah, remember we talked about those.
Right.
So instead of having to travel hundreds of miles, imagine being able to access those services closer to home.
What kind of services?
Well, think about diagnostic labs or even tertiary hospitals right there in your region.
That would be amazing.
It would take a lot of pressure off patients and their families, and it would help those overcrowded urban hospitals, too.
So everyone wins.
Exactly.
What about technology? Could something like telemedicine help?
Absolutely. A specialist in Ranchi could consult with a patient in a village using video chat.
So you're basically bringing the specialist to the patient virtually.
Right.
That's really cool. But of course, not everyone has internet access.
That's true. It's a challenge, but the potential is huge.
Definitely. So we've talked about specialized care, but what about malnutrition? We touched on that earlier, and it seems like a really big problem in Jharkhand.
It is, especially among children.
Are there any solutions on the horizon?
Yeah, there are some promising things happening. Remember Poshan Abhiyan?
Right, the national program.
Yeah, it's not just about giving people food. It's about giving them the knowledge and tools to make healthy choices.
So it's about empowering communities.
Exactly. It's got things like supplementary nutrition programs, but also education, behavior change, community involvement.
So it's a multi-pronged approach.
It has to be. Malnutrition is a complex issue.
It takes a village.
It really does. The government, healthcare providers, and the communities all have to work together.
And the ASA workers, they must be really important in all of this.
Oh, they're essential. They're the ones working directly with families, providing education and support, making sure people understand how to stay healthy.
One thing that I found really interesting was the mention of traditional healthcare practices, especially in those tribal communities.
Oh, yeah.
It seems like there's a growing recognition that those traditions have value.
Yeah, definitely. Those communities have been relying on those practices for generations.
So how can we integrate that knowledge into the modern healthcare system?
That's a great question. It's about finding a balance, respecting those cultural beliefs, but also making sure people have access to the most effective treatments.
So it's not about one or the other. It's about finding a way to make them work together.
Right. Healthcare isn't one size fits all. It needs to be tailored to the needs of each community.
We've talked a lot about the challenges, but I'm curious about the successes too. What's working well in Jharkhand?
Well, one of the big successes has been Mission Indradhanush.
The vaccination program.
Yeah, they've really increased immunization rates, which has led to a decline in those preventable diseases.
That's fantastic.
It's a big win.
What about those mobile medical units? Are they making a difference?
Definitely, they're bringing healthcare to those remote communities who might not have access otherwise.
So they're literally reaching people where they are.
Exactly. And it's not just about treatment. They also do health education and early disease detection.
They're lifesavers.
They really are.
I'm also really interested in the growing use of technology, not just telemedicine, but things like mobile health apps.
Oh, yeah.
Imagine having health information and even virtual consultations right on your phone.
It's amazing. It's all about empowering people to take control of their own health.
So it seems like Jharkhand's healthcare system is a mix of challenges and opportunities.
It is.
There's a lot of innovation happening, but those hurdles are still there.
Right. It's a complex journey, but it's encouraging to see the dedication of the healthcare workers and the resilience of the communities.
And the creativity of those solutions.
Exactly. It's a story that's still being written.
And it's a story about people, isn't it? The doctors, the nurses, the ASA workers, the patients, the families.
Absolutely. It's about the human impact of all of this.
In the final part of our deep dive, we'll hear from some of those people on the front lines of healthcare in Jharkhand.
Yeah, we'll get to hear their stories and their perspectives.
I can't wait. Stay tuned, everyone. All right, so we're back for the final part of our deep dive into healthcare in Jharkhand. And this time, we're really going to get personal.
Yeah, we're going beyond the numbers and the programs and hearing from the people who are actually living this every day.
Exactly. The healthcare workers, the patients, the communities themselves.
Right. Their voices are so important.
One thing that really struck me was the dedication of the healthcare professionals in Jharkhand.
Oh, yeah.
I mean, working in those rural areas with limited resources, it can't be easy.
It's definitely not easy.
Yeah.
You know, the sources talk about doctors and nurses working in these rural hospitals, dealing with staff shortages, outdated equipment. Sometimes they don't even have reliable electricity.
Wow.
And they're still providing care to people who really need it.
It's amazing that they're so committed to serving their communities, even when things are tough.
It really is. And then there are the SAA workers.
Yeah, we've talked about them a lot.
We have, but their stories are just incredible.
What do you mean?
Well, imagine walking miles every day to reach these remote villages.
Yeah.
Sometimes facing cultural barriers and skepticism, and all to educate people about health and connect them to the healthcare system.
It's like they're pioneers.
They really are.
Forging a path to better health.
And they do it all for very little pay and often not much recognition.
That's incredible.
It shows how much they believe in what they're doing.
They're the backbone of the system, especially in those areas where access is a real challenge.
For sure.
But what about the patients? What's it like for them to navigate this system?
Well, one source told a story about a young mother in a tribal village.
Great.
Her child was really sick, and she had to travel for days to reach a hospital that could help.
Oh, wow.
And it wasn't just the distance she had to deal with, the cost, the language barriers, and just not knowing what her options were.
That's heartbreaking.
It is. It shows that even with all the progress, there are still so many people struggling to get the care they need.
It's a reminder that healthcare isn't always equal.
No, it's not. And it shows how important it is to find solutions that work for these communities.
Solutions like those mobile medical units and telemedicine.
Exactly. We have to find ways to bridge those gaps, whether they're geographical, financial, or cultural.
So it's about meeting people where they are.
Right. And it's also about empowering communities to take charge of their own health.
Okay, how do we do that?
Well, one source talked about the success of community-based health programs.
Oh, so the community gets involved in deciding what they need.
Exactly. They work together to figure out what the priorities are and how to address them.
That makes sense.
It's a bottom-up approach, and it often leads to solutions that are more effective and culturally sensitive.
It's amazing how all these pieces fit together, from the big policies to those community efforts.
It's a complex system.
It takes everyone working together to create a healthcare system that really works for everyone.
Absolutely.
So we've talked about the challenges and the successes in those community efforts, but what about those policy recommendations? What needs to happen at a higher level?
Well, we need to expand medical education and training, offer incentives to attract doctors to rural areas, improve infrastructure, and strengthen preventive measures.
Those are all big things.
They are, but it's not enough to just make those changes. We have to make sure they're actually working.
Right, they have to be making a difference in people's lives.
Exactly. We need accountability, transparency, and constant evaluation and improvement.
So it's a never-ending process.
It is. Healthcare is always evolving.
So as we wrap up this deep dive into healthcare in Jharkhand, What are the key takeaways?
For me, the biggest takeaway is the power of collaboration.
Oh, yeah.
Whether it's the government and private sector working together or communities coming together or those healthcare professionals going above and beyond, it's clear that we can achieve so much more when we work together.
I totally agree. And for our listener, what would you say is the key takeaway?
I think it's important to remember that Jharkhand's healthcare system is a work in progress. There are challenges, yes, but there's also a lot of progress being made.
And a lot of people who are dedicated to making things better.
Exactly. And don't forget about the human element behind all those statistics and policies. There are real people with real stories.
The doctors, the nurses, the ASHA workers.
Yeah, their stories are a powerful reminder of why this work is so important.
It's not just about numbers, it's about people's lives.
Exactly. So as you continue to learn about this topic, keep those stories in mind.
They give us a glimpse into what's really happening on the ground.
I do.
This has been a truly eye-opening journey. Thank you for joining us on this deep dive into healthcare in Jharkhand.
It's been my pleasure.
We hope you've learned something new and maybe even feel inspired to get involved in making a difference.
We all have a role to play in creating a healthier future.
That's right. Thanks for listening, everyone.